Cost of living, crime in our society, interest rates, housing crisis, climate change and immigration are all major issues that the public is concerned with. Election promises must be evaluated. Why hasn't this already been done?
The reason why Medicare needs this response is to repair the damage that was done when Peter Dutton was the Health Minister. The freezing of the Medicare rebate for 6 years that he introduced as Health Minister at the same time as $50 billion was cut from hospital funding, same time as he tried to introduce a GP tax and a tax on visiting an emergency department and a tax on pharmaceuticals. He said that repeatedly when trying to introduce this tax on visiting the GP. So we've come up with this policy that builds on what we did a year ago in the budget. We've only been here for less than 3 years, and we introduced the biggest reform and funding for Medicare by having the tripling of the bulk billing incentive. Now, that was for 11 million Australians who are concession card holders, so people with families or pensioners. That has resulted in more than 90% bulk billing. Now, what we've done is take that evidence and say it should be applied across the board for every Australian so that everyone can get that access to Medicare that we think is at the heart of the health system.
But do you understand how people feel frustrated that it hasn't been done already? Because bulk billing rates have been in decline.
Oh, absolutely. But what we've done is improved the Medicare rebate in each and every year that we've been in government. We tripled that bulk billing incentive. Now, before yesterday, that was the biggest additional funding to Medicare since Medicare was created by the Hawke government.